Why is a rheumatologist important for lupus diagnosis? Imagine trying to solve a puzzle with many missing pieces. That's what diagnosing lupus can feel like, because its symptoms are so varied and often mimic other diseases. A rheumatologist is a doctor who specializes in autoimmune and connective tissue diseases, making them essential in this complex process. They have the expertise to piece together the clues that lead to an accurate diagnosis. Lupus is a chronic autoimmune disease where the immune system mistakenly attacks healthy tissues, causing inflammation and damage across many organs. Because symptoms like fatigue, joint pain, rashes, and fever are common to many conditions, it's not easy to identify lupus without specialized knowledge. A rheumatologist understands the wide range of lupus symptoms and how they can change over time, which is crucial for making sense of the puzzle. Diagnosing lupus involves a detailed medical history and tracking symptoms over time. The rheumatologist reviews the patient's past health, family history of autoimmune diseases, and current symptoms. They perform a physical exam to look for characteristic signs, such as the butterfly-shaped rash across the cheeks and nose, joint swelling, or skin rashes. These signs can be subtle and requiring a trained to recognize. Blood and urine tests are also key. The initial test often used is the anti-nuclear antibody test, which most people with lupus test positive for. However, a positive result alone doesn't confirm lupus, so the rheumatologist orders more specific antibody tests. These include anti-double-stranded DNA, anti-Smith, and other antibodies that help confirm the diagnosis. Blood counts are checked to see if there's anemia or low white blood cells, common in lupus, and tests for inflammation. Urinalysis helps assess if the kidneys are affected by checking for protein or blood in the urine. Sometimes, tissue biopsies of the skin or kidney are needed to look for autoimmune damage directly. Because lupus symptoms and test results can overlap with other conditions like rheumatoid arthritis or infections, a rheumatologist carefully rules out these possibilities. This process often involves multiple tests and expert judgment to avoid misdiagnosis. Their specialized training allows them to interpret complex results and recognize patterns that point to lupus. Once diagnosed, managing lupus requires a personalized approach. There is no cure, but treatments like anti-inflammatory drugs, corticosteroids, and immunosuppressants can control symptoms and prevent organ damage. The rheumatologist guides patients through medication choices, lifestyle changes, and regular monitoring to keep the disease in check. They also emphasize the importance of sun protection, healthy diet, exercise, and avoiding smoking to improve quality of life. In summary, a rheumatologist is vital because they bring the specialized knowledge needed to navigate the complex diagnostic journey of lupus. Their expertise ensures that patients receive an accurate diagnosis and tailored treatment plan, helping them live healthier lives despite the challenges of this autoimmune disease. Always remember to consult a healthcare professional for personalized advice and care.